Romana.
So today we have a research presentation by Nirmala and Jessy on does blood test help in decoding comprehensive mental health?
Hello everyone. Hope the screen is visible. Today's topic is on the role of blood test in mental health and understanding the connection between the two. So, we all know that mental health is a complex interplay of various factors, the person's childhood, the genetics that the person has from their parents and from their ancestors, the environment that they grow up, the lifestyle that they choose to have, and their psychology, like their interplay, the thoughts that they have, the emotions that they allow in themselves. So, this blood test, they say that they have a lot of information in them, and it helps in the diagnosis, the giving a proper diagnosis of what the condition the client is undergoing. Let's say that they have a mental health condition, some issues, and it also helps in the management and prognosis, better treatment in the condition. So recently this has evolved, and they because of the connection, blood test and using the blood chemistry has increased while treating clients with mental health conditions. So the first factor that is that the use of blood test is coming up with a very proper diagnosis of the client's condition. Many times clients are misdiagnosed for their mental health condition because there are so many factors involved, not just their mood and emotions, but also their biology is involved in their cognition and their affect. So for example, thyroid disorders, vitamin deficiencies, hormonal imbalances also affect how the person functions, their mood, and the affect. So sometimes misdiagnosis can lead to a very improper treatment for the client, and as a result, their condition is not treated and it remains for a very long time. For example, there was a patient a woman of who was like 30 years old, who was misdiagnosed to have depression and bipolar disorder, but she was actually suffering with premenstrual dysmorphic disorder, which happened because of her hormonal imbalance. So she stayed in wrong medication and therapeutic treatment for very long years. Later, she was diagnosed clearly because of with the help of blood test and all the uh, other tests that was taken on her, and then later proper diagnosis was given, and when she was treated for the right condition, her symptoms elevated and she got better very soon. The second use of blood test in mental health is monitoring the condition. After the proper diagnosis, when the client is monitored properly, like all the levels in their bloodstream is monitored. Let's say the client is given antidepressants for severe depression that they have. These monitoring can make sure that the medication helps the patient to stay within the therapeutic range and doesn't cause adverse effect on them. Let's say more lethargy and numbing is not caused. Maybe the previous condition was insomnia. The insomnia is elevated, but it does not lead to high levels of lethargy or sleeping for very long hours. And also blood test can also help us to monitor how their organs functions, because psychiatric medications does have effect side effects on the body functions, body organs. So these blood tests can helps us to keep those things in check. And the third use of blood test is it is used to make sure the markers are in proper place. Let's say there's inflammation. Inflammation is the body's response when there is an infection or injury in the body. So when there is an inflammation, our immune system goes to that part of the body and make sure it is healed. So it starts off as a very acute inflammation, but slowly it becomes a chronic inflammation when our body lacks the proper nutrition, vitamins and minerals for it to heal. So when the inflammation is more, it is reflected in the bloodstream as a heightened presence of C-reactive protein. So this is a marker which can be studied by blood chemists, and this can help or make sure that the inflammation is monitored and kept in check. So why should we study inflammation in the body? So there are a lot of studies that show that a person who has severe mental health condition like depression can have high levels of inflammation, that is C-reactive protein in their body. So when we understand all these things, better measures of handling them, like giving them supplements that make sure the inflammation is reduced, and omega 3 can be prescribed to the patient, can all be done later. Next slide. From here, Nirmala will take over.
Thank you so much, Jesse. Now, let's move on to genetic testing. Genetic testing using blood sample is an incredibly powerful tool that provides us with very valuable insights onto the genetic factors which underlie various health conditions, including mental health conditions like depression and other mood disorders. Genetic testing for mental health conditions focuses specifically on genes that affects the chemicals in our brain, which we call as neurotransmitters, that are actually responsible for managing our mood, emotions, and behavior. In specific, let's consider serotonin. So, serotonin is basically a neurotransmitter that's closely associated with managing our emotions. So, mood regulation is one of the basic functions of serotonin. So, any variation or mutations in the gene that regulate the production, transportation, or the reception of serotonin can entirely disrupt the mood functioning of an individual. With this information in our hand, as a therapist, we can actually develop a more comprehensive treatment plan that is tailored to each individual. So that's very important to have all these tests in our hands. Moving forward, let's take a look at the nutritional deficiencies. Next slide, Jesse. Blood tests are an effective way to identify any deficiencies in the nutrients that are very, very important for a body to function properly. When the body lacks these nutrients, it can lead to various mental health and physical health issues, including mood disorders. For instance, there has been a study that has found a link between low levels of vitamin D, folate, and omega 3 fatty acids and an increased risk of depression and other mood disorders. So it's very important that we also take into consideration other biological factors which might play a predominant role when it comes to diagnosing any mental health conditions. Next slide. Now coming to the conclusion. The use of blood tests in mental health arena represents a groundbreaking shift in how we basically approach the diagnosis, treatment, and management of mental health conditions. Blood tests, yes, certainly have the potential to revolutionize the mental health care by enabling personalized treatment plans tailored to individual biological profiles. While we have made significant strides, it's very, very important to know that there's still a lot to learn and explore in the realm of blood tests and mental health. And it's also essential to know that all the psychological and mental health conditions are multifaceted in etiology. Therefore, it's very, very important to know that blood tests just add to the toolkit and not replace any established therapies and personalized mental health guidance. Therefore, always offering a holistic approach which considers biological, psychological, physical, social, environmental, and biopsychosocial factors into consideration for providing a very comprehensive and effective care for individuals with various mental health conditions. Now, we have a case study. So Namrata, a 38-year-old software developer, has been struggling with symptoms of major depressive disorder for several years. Despite trying multiple antidepressants and various psychotherapy techniques, her response has been very, very minimal. Suggested a comprehensive approach which includes the use of blood tests to better understand the biological underpinnings for her depression and to provide a more comprehensive treatment plan. Some of the blood works that he ordered include CBC, complete blood count, a comprehensive metabolic panel. So these blood tests help us rule out any chances of anemia, thyroid issues, or any metabolic disturbances. He also ordered some inflammatory markers, as Jesse told, C reactive proteins and interleukin 6. Any levels, which the levels in if they are elevated, they can indicate inflammation. which has been strongly linked to depression. And some other tests that he ordered include vitamin D and B12. The findings of these results showed that she had a very normal CBC. The complete blood count was very normal, and the CMP was also very normal, which excludes any metabolic or endocrine issues. Next, she showed elevated levels of C-reactive proteins and interleukin 6, which indicates there's a very possible sign of inflammation in her body. And there's also a slight vitamin D deficiency that was noted. So, based on these results, her psychiatrist recommended a multifaceted treatment approach. First, he started an anti inflammatory diet and prescribed omega 3 supplements to address that inflammation. So, first step was providing anti-inflammatory diet. Next, supplementing with vitamin D. Supplementing with vitamin D deficiency along with pills like magnesium and vitamin K, which are proven to play a major role in the absorption of vitamin D. So each time any doctors generally prescribe vitamin D, they also prescribe vitamin K and vitamin magnesium so that it's being very well absorbed in the body. So that's one thing. And continuing psychotherapy, focusing on cognitive behavioral techniques. So these were the treatment and intervention approaches that was taken up by her psychiatrist. After 3 months on this treatment regimen, Namrata reported significant improvement in her depressive symptoms. She also tolerated very well to the medications with very minimal side effects. Her energy levels increased, and she also found herself to be more engaged with the day to day activities and work. So this case basically demonstrates the importance of considering a broad range of biological factors when it comes to the treatment of mental health conditions. While not every patient might respond as Namrata did, but it's still very essential to incorporate blood tests into our diagnostic process as they offer a valuable tool in the quest for a more personalized and effective treatment in the mental health care. Next slide. Right. So now we have a quiz. First, what can blood tests potentially reveal about mental health? Option A, genetic predisposition to certain mental health conditions. B, levels of vitamins and minerals that affect the brain function. C, markers of inflammation that could be linked to mental health conditions. D, all of the above. So which do you think is the right answer? Absolutely. Thank you so much. The right answer is all of the above. Next question. How might genetic testing through blood samples aid in mental health treatment? A, by identifying individuals who might respond better to certain medications. B, confirming that an individual does not actually have a mental health condition. C, completely curing the mental health condition through gene editing. D, proving that mental health conditions are not real. What do you think is the right answer? Yes, Melo, you're right. The option is A. With that, we come to the end of our presentation. Thank you all for your attention and active participation. Have a beautiful day.
Thank you, team, for an interesting presentation on the topic. We will move towards the feedback. Hushi, any feedback from you?
Yes, it was a really great presentation, and I think it gives us a lot of insight in how we can better help our clients with a very holistic approach. And I think this also proves how strong there is a link between the body and the mind. So, thank you, guys.
Great. Antama, any feedback from you?
Hi, it was a very well researched and insightful presentation. Thank you so much.
Arunima?
Yeah, hi. This was a very good presentation. It's actually a topic that has interested me for a while. I knew about vitamin D affecting depression and some other disorders, but some of these really surprised me. Thank you for this.
Great. If anyone has any question, you can ask now. If no, we can end the research presentation here. Over to you, sir.
Thanks, guys. Very interesting presentation. I think it'll tie in closely with our workshop that we're creating on B12. Great job, guys. Okay, moving on.